Hi, my name is Dr. Rina Allawh. Welcome to Skin the Surface, a monthly segment where we address important topics related to your skin. This show is intended to serve as an educational resource for members of our community. Our hope is that we encourage you to take a more active role in your skin health. We do not provide any personal medical advice, so if you feel like any of these issues we discuss apply to you, and we hope that many of them do, we recommend that you consult with your board-certified dermatologist for more information. On today's episode, we'll be focusing on skin conditions in skin of color patients. People of skin of color are a diverse racial and ethnic background, including but not limited to African Americans, Asians, Hispanics, or Latinos, Native Indians, and Pacific Islanders. Although skin conditions may affect any individual, certain conditions including skin cancer, which we'll go into a little bit later, can present differently in skin of color. Additionally, certain skin conditions can affect patients with skin of color more frequently, with more severity, and even certain conditions are unique to this group of patients. Today, I'm very excited to be joined by Dr. Christina Chung as we discuss various topics related to skin of color. Dr. Chung is a local board-certified dermatologist whose clinical practice and research focus has reflected her unique interest in skin diseases in skin of color patients, specifically transplant patients. She has published groundbreaking papers on this topic and has spoken about her work in non-white transplant recipients. Welcome, Dr. Chung.
Thanks for having me, Dr. Allawh. It's a pleasure.
So let's jump right into it. So the first topic I would like to discuss is skin discoloration or dyspigmentation. And these are terms that reflect both hypopigmentation and hyperpigmentation. So Dr. Chung, as a dermatologist, when you approach patients who are coming in for post-inflammatory hyperpigmentation, what is your general approach and how do you encounter these issues in skin of color patients?
So the first thing I do when I am treating a patient whose primary concern is dyspigmentation, I often start by discussing kind of what's happening and why it's happening. I think that's very important for the patient to understand. I feel like dyspigmentation, I guess primarily hyperpigmentation, is almost the number one complaint or issue that I hear from my patients, particularly who are on the more darkly pigmented and the more Fitzpatrick skin type 5-ish. 4 or 5 patients. And what I do first is explain to them kind of why people of color, such as myself and yourself, tend to hyperpigment. I like to talk to them about whatever underlying issue is causing their pigmentation or their dyspigmentation. And then the first thing I really do is talk to them about sunscreen. Through the years of practice, and research into kind of skin cancer and the risk factors, I've realized that so many people of color are not counseled or well educated about sunscreen. So I really do talk a lot with them about the importance of sunscreen and why for people with skin of color that it might not be the number one factor in preventing skin cancer, but it may be the number one factor in preventing dyspigmentation related to age or treating refractory hyperpigmentation due to like inflammation from eczema or pimples or things like that. So I've kind of shifted my focus to trying to counsel the patients strongly about how sunscreen, how much sun plays a role in pigmentation and how sunscreen, at least for them, may not be so important to prevent a skin cancer, but may be very important to preventing dyspigmentation and kind of sun-related aging of the skin as patients age or as they treat or go down the path with eczema or pimples or any sort of inflammatory condition.
Mm-hmm. No, that's a great point. Oh, no, I was just going to say that's a great point because I feel like that's a great way to convince patients of, I hear a lot from a lot of my skin or color patients that they don't think that they could ever have or at risk for having skin cancer and they don't need sunscreen. And so that's a great, way to convince them to use sunscreen is to prevent or minimize the the risk of having that hyperpigmentation. In terms of when patients do have that hyperpigmentation, do you counsel them on certain safe skin lightening practices or laser procedures?
So I don't really like to call it skin lightening. I kind of think about for folks of color, one of the biggest problems is just dyspigmentation. They kind of get the light skin, the darker skin, the tan patches. And so I feel like one of the biggest complaints is kind of the skin is just not even toned. So I feel like what I like to do is I like to talk to the patients about remedies for evening their skin tone out, so that their skin tone is homogeneous, whether that's light or dark. I like to think about, I think that all of us know that in the aging process that evenly pigmented skin is youthful looking. Or even if you have eczema and or psoriasis and you have dark patches on the skin, most people like to have kind of that even skin tone and don't like to have that residual darkness or lightness or pinkness that's left over from inflammation. So my go-to product is, and I think the studies have shown that the triple combination of Kligman's formula of hydroquinone, a topical retinoid, and a corticosteroid is my go-to therapy for patients who are complaining of pigmentary issues. I do think that there are recent studies that have also proven the safety of particularly hydroquinone. I think that's definitely been the one controversial ingredient in the past. The triple combination, I think, does a very, very good job. I think that obtaining the product sometimes can be a little bit difficult, but I like to definitely start there, counsel the patients about proper use of such a product. And then usually I encourage patients to, depending on their skin type and tone, I like to encourage them to perhaps consider laser therapy. Salicylic acid peels tend to do a very good job as well if you do them in succession. But a lot of those procedures that can cause inflammation in the skin, like laser procedures, like alpha hydroxy acid peels, can lead to some inflammation. So really they need to be pre-treated with the triple combination cream prior.
That's a great point. And I know you mentioned skin cancer in skin of color patients. And I really want to talk about this with you because I know this is your a main focus of your research. I often hear from patients that they don't need to worry about skin cancer and that their pigmentation in their skin or the melanin in their skin protects them from the sun's harmful rays. And I'm sure you hear this as well. And I know this is a particular focus of your research, but can you talk to us more about skin cancer and skin of color patients and discuss what patient population is more at risk?
Sure. So did you want me to talk about risk factors or particular groups of people?
Risk factors, and then what types of skin cancers do we see in skin of color patients, and then when you counsel them, how often should skin of color patients be screened for skin cancers?
Got it. So risk factors. So the research that I have done has really been concentrated around organ transplant recipients. So these patients are immunocompromised, which means their bodies can't fight off anything that their immune system would be trying to fight. And that includes infections. And infections have kind of been the focus, I think, of side effects and I guess diseases for confronted by patients who are chronically immunosuppressed. And I think a lot of times people fail to recognize that your body is not surveilling properly, and that one of the things that it does not fight properly is anything that is aberrant, including tumor cells in the skin, or in the body anywhere. So transplant recipients in general not only are and chronically immunosuppressed folks, that includes patients with cancers, graft-versus-host disease, other patients who are chronically immunosuppressed because of iatrogenic or medical or medicines. And so these patients tend to be at increased risk for all types of cancers. And one of the things that they have recognized, which has shown recently, is that and this is done by one of my colleagues out in California, and that kind of looked at a huge population of transplant recipients around the country at numerous institutions, they piled all their data, and what they found was that organ transplant recipients, because of their chronic immunosuppression, die more frequently of skin cancer post-transplant than they do of any other cancer, including breast or colon. And so we've kind of, the field has kind of really been looking at what types of skin cancers and things like that are suffered by transplant recipients. And when I started our group, Rina, or Dr. Allawh, you and I worked together at our program down at Drexel University for quite some time. We recognized that our transplant patients were nearly 3/4 folks of color. And so what was striking to us was that we weren't seeing the rates or types of skin cancers that had been reported traditionally in the literature, but instead we were seeing different trends in the transplant recipients of color, the Asian, the Black, and the Latino population that we served and that we took care of at Drexel. And so serendipitously, my group ended up kind of looking at the trends and kind of what was appearing. And it's not that the transplant recipients of color, it's not that they were not at risk for skin cancer. They were just, skin cancer just appeared at a lower rate. But even the trends were completely different. So I guess to not belabor the topic, not unsurprisingly, people of color who had transplants and were chronically immunosuppressed, we found that those with lighter skin tones tend to develop more skin cancer that was related to the sun. And what was interesting was that there were trends amongst just the larger racial groups that kind of mirrored one another. What was interesting is that when you looked at our white population and our Asian population, that they tended to get skin cancer in the same distribution. They tend to get skin cancer kind of in the sun-exposed head and neck, partially sun-exposed arm areas. You know, we tend to think of basal cell carcinoma and squamous cell carcinoma as sun-related skin cancers, and they were getting these skin cancers, excuse me, in those sun-exposed locations. The Latino transplant population and our Black transplant population kind of mirrored one another, kind of makes sense a little bit more because they tend to have more pigment in their skin. They tended to really develop skin cancer in partially or even sun-protected areas like the groin and the lower extremities. But the one striking thing when we started looking at all of our data was that in particular, Black transplant recipients really predominantly developed skin cancer that was not sun-related in sun-protected areas like the groin and the genitalia. And we looked into that a little bit further across all the races. We found that those folks who were persons of color tended to get many, many, many more skin cancers in the groin related to HPV. I think a lot of us are familiar with the HPV virus. I think that the community is familiar with the fact that that kind of is synonymous with the wart virus. I think traditionally we think of the HPV virus in the context of cervical cancer because of the vaccines that have been developed against it. So what we found to be very interesting was that while it was not the female genitalia, it was not kind of internal cervical mucosal skin, that the genitalia, the groin, the penile shaft, the vulvar area, that this is where our transplant recipients of color were developing skin cancers. And this is completely separate from the sun, clearly. And what was most striking was that nearly all of our Black transplant recipients who developed squamous cell carcinoma, actually all of them developed squamous cell carcinoma from HPV and not the sun. And so these are very interesting trends that we saw happening. And what we concluded with this years and body of research is that organ transplant recipients of color are not immune to skin cancer from the sun. there are risk factors for this, and the incidence of sun-related skin cancer is likely significantly lower in certain racial groups when compared to white transplant recipients, and that there are likely an entirely separate set of risk factors for development of skin cancer in this population, particularly in the Black transplant recipient population, that until now perhaps has not been identified, and that kind of is a space for skin cancer research that really needs to be teased out and have resources devoted to. Because essentially what that means is that what the question that arises from this really is, are we as dermatologists, irrespective of treating populations who are compromised or immunocompromised, are we screening for skin cancer and counseling our patients of color properly about their risk and how to mitigate it? And are we adequately screening the population, or the population of color, for those who are at higher risk? Because I think traditionally our tools for skin cancer risk that kind of divide people into higher risk, lower risk are really predicated on sun-related skin factors that have been born of a lot of skin cancer research that has been predominantly performed from data from the white population. I think that this is an area that is ripe for research and really needs physicians and stakeholders in skin cancer prevention to kind of look at even more closely. I think that the dermatology community in general knows that people of color tend to develop skin cancer, tend to not know they can be at risk. I think they tend to present at later stages and have significantly higher mortality, particularly from melanoma as well. So I think this is something that I think that our field in medicine in general needs to address, that one size perhaps doesn't fit all in medicine. And I'm just glad that I've been able to and hope to further contribute to that dissemination of information and clarity.
Yeah, I mean, that's an amazing point. I think that after working with Dr. Chung and working on her research projects throughout my training, it really opened my eyes and honestly tailored my approach to examining patients of skin of color, pigmented skin, and really looking at the genital, doing a thorough genital exam, counseling them on their risk factors. And so I think that's all great points. I think that it needs to be more, I think that it's a growing concern now that that these patients are not being adequately screened either, or counseled by primary care physicians or their geriatricians. And so, shifting, getting that word out there that we need to be more focused on counseling these patients is extremely important. So when you talk about your screening model, you talk about, I know that we've talked about this before in the past, but in the past with transplant patients, it's, oh, hey, you've got something, you should go see a dermatologist. Do you think that all transplant patients, even, Caucasian and patients of skin of color, should be screened pre-transplant and then post-transplant? And how often?
So in a perfect world where everybody was resourced well and there were enough academic dermatologists or dermatologists in general in the communities where transplant recipients live, I think in a perfect world that yes, most transplant recipients prior to transplantation and post-transplantation should be screened, or at least their risk should be assessed, and that they likely should be screened at baseline pre and post-transplant for skin cancer. I think that one of the controversies within the field is what is the best utilization of our healthcare resources. And clearly not everyone needs to be scanned all the time, every year, every 6 months. So what the transplant dermatology group that I belong to, the International Transplant Skin Cancer Collaborative, has done kind of a Delphi panel where we incorporated 97 dermatologists. They were dermatologists, surgical dermatologists, and transplant medicine and surgery folks from around the country to kind of create these kind of recommendations and guidelines, so to speak, about skin cancer screening in the transplant population. And ended up dividing it down by race. Unfortunately, that's the best proxy that we could use for skin color at this point academically. And pretty much what we decided was that folks with a pre-transplant history of skin cancer really needed to be screened, assessed prior to transplant, routinely prior to transplant, routinely prior post-transplant, simply because that risk of skin cancer, particularly squamous cell carcinoma, the risk of skin cancer is just so increased in these patients. And because the skin cancers that immunocompromised patients do develop tend to be more aggressive, tend to recur, and tend to metastasize and cause mortality. It was determined among the group that white transplant patients, high risk, likely should be screened within 2 years post-transplant. And this is all based on, do you have the resources to do it? And that after that, transplant recipients of color likely should be screened within 5 years post-transplant. And these numbers are because average time to onset post-transplant of skin cancer is likely, the lag time is likely about average, 3 to 9 years. So 5 years kind of is right in the middle. And clearly people who are at higher risk with pre-transplant history of skin cancer and lighter skin tend to have increased risk. So those patients likely should be screened a little earlier than the first 5 years post-transplant. Afterwards, we really have not made any recommendations about how often they should be screened and at what intervals. What I personally like to do is for transplant recipients of color who really have no risk that I've seen regularly, I like to say, come back at least every 2 years or so. For transplant recipients of color, I really do like to see them every year. And because the risk is so high for those patients who have solid organ transplants, who have had precancerous or cancerous lesions, I really do like to see them every 3 months.
Great. And then just to add to that, are there any tips for sun protection that you recommend for patients for skin of color? I know that sunscreen is obviously, as you recommended, a recommendation. Are there any certain sunscreens that you recommend for patients who don't like, are skin of color and don't like to apply certain thick white sunscreens on their skin?
So I do think that this is also a field in the cosmeceutical industry that needs to be teased out further and needs to be developed. And I understand that there are efforts to do so, but it's very difficult for patients who are more darkly pigmented. Even for myself, I find it very difficult to find a good mineral sunscreen that is a physical blocker to apply that doesn't leave a white paste. There are several nice sunscreens out in the market that do have tinted mineral protection. The two I like to recommend are Coats Skincare, mostly because Coats is a local Norristown, Philadelphia-based company that creates wonderful mineral-free, reef-friendly, or mineral reef-friendly sunscreen, and they have a fantastic foam that is really easy to apply that they do in tinted and non-tinted versions, and they have a whole line of products. So that is probably my favorite go-to product. I just to support the local businesses. Other than that, the large label companies do have lots of tinted varieties of sunscreen. Another thing that I do like to counsel all of my transplant recipients of color and even my young patients of color is about the HPV vaccine. There is a body of evidence that is coming out that perhaps that is testing the hypothesis that the HPV vaccine may really help in preventing squamous cell carcinoma, that cutaneous squamous cell carcinoma that may arise in these genital areas. It's the reason why we do it now for all the young children is because of cervical cancer. But that is another area and another preventative measure that perhaps isn't widely thought of that really may help decrease the risk of skin cancer in patients of color, particularly transplant recipients of color.
Great. That's amazing advice. I just wanted to thank you so much, Dr. Chung, for being our special guest. That's all we have for today. Thank you so much for joining in today's discussion about your skin. We hope that you all learned something new today. And if you really like what you heard, then please check out our website at skinthesurfacepod.com. I will also post links to the International Transplant Organization website, as well as the Skin of Color Society website. as well as links for Dr. Chung's social media pages and the Philadelphia Phoenix. Thank you all, and as always, stay safe.
Thanks for having me.